We don't know the origins of the coronavirus. And we're not going to know for quite some time, Jan, because the Beijing government is preventing everyone from finding out. CDC, the Centers for Disease Control and Prevention, they're not allowed into China. It is worse than the numbers suggest. So for instance, today, China is admitting to 2,004 deaths. And that's got to be many, many multiples of that. They're admitting to 74,200 or so infections, many, many times multiple of that as well.
Well, and it's, I think you were mentioning the WHO a bit earlier, and it's bizarre that, the WHO is obviously like highly cooperative with the Chinese Communist Party.
That's a very, very diplomatic way of putting it.
Well, they haven't been allowed into the epicenter, ostensibly the epicenter, right? As far as I understand
it.
Yeah,
they haven't. Right? They're going to Guangdong, they're going to Beijing. They're just going to, they might as well be going to Iceland for all of this. This is just ridiculous. And the World Health Organization sees it's more important to support communism in China than it is to end this disease. And so that's really wrong. I think the WHO Director General should resign. I think the organization should just disband, send the staff functions, the technical stuff to other places. But really, this is creating a very bad situation.
That officials in Wuhan have been manipulating data in order to have the data reconciled with a 2% case fatality rate. So if you only report so many cases,
right,
and then you have a fatality rate, then somehow it comes out at 2%. A very different city on the other side of China that is having a huge outbreak reports a 4.8% case fatality rate.
I am Rob from iTech Pickers. This is the time for our coronavirus update. We are Friday, the 21st of February, 2020. And like the subject that I'd like to talk about tonight, I think it's very important that you hear this. I have, since there has been bigger numbers outside of China, of course we are starting to see cases in the hundreds in different countries. We have seen, like today I've seen South Korea now has about 324 cases. I think there's been like 200 new cases in the last 24 hours. And of course we've seen a few more deaths outside of China. And every day I've been calculating the number of deaths and the number of people who have recovered. And I've done the calculation on a daily basis. And it seems that the fatality rate of the coronavirus is actually about 5%. The numbers that I get are between 4.5% and now today I get 6%. So on an average, it's about 5% and not the 2% that that is floating around and that is being repeated by clueless people who have obviously they have not done the calculation. So you can actually do the calculation yourself. I will show you how to do that. So of course we have seen the cases upon cases of coronavirus that they have found in Daegu, South Korea. It's a church of 1,000 members, and it seems that this church, which are comparable to the Jehovah's Witnesses that we have here in Canada and the US. They are people who are regrouping in the same building, and they actually believe that God is going to save them from the coronavirus. It seems that they were not wearing masks during their meetings. And so now so far they have picked out 324 cases totally in South Korea, but there's about 275 cases that come out of that church. So now the city of Daegu, which is about 300 kilometers south from Seoul, is in a lockdown. And I think there's another town that's also in a lockdown right beside Daegu. And they are trying to contain the outbreak. So this is why you see all of these cases that have popped up in South Korea. And so far they have 2 people dead. So this is really tragic. And of course we can expect to see more people dying there in South Korea. I hope they do contain the virus in that small town and it doesn't spread to the big city like Seoul. In fact, because I will be in Seoul in about 2 weeks, so I'm just keeping my fingers crossed. I thought I would be safe there, but it just seems that we cannot be safe anywhere right now. In Italy, they are putting a number of towns in quarantine. There is some kind of an outbreak there. I think there's 1 people dead right now. In Iran, it seems that there is an outbreak in Iran, in Tehran, and in another town next to Tehran. They now have 4 people dead. So how many people got infected before this? We have no idea. So you have seen the Diamond Princess with 620 something people dead, and I mean, this is spreading really, really fast. Actually, faster than I believed at first. I knew this was going to become global, but I had no idea this would become global that fast. And every day I do the calculation and I come up with something that looks like a 5% fatality rate. So that's the important thing that you should get from this podcast. So finally, here are the numbers for tonight. We are Friday night, February the 21st. As you can see, big number here in South Korea. Now 346 total cases, 2 deaths. Japan now 109 cases. And now there are 35 cases in the US. I have told you in a prior podcast that I have knowledge that they are detaining several hundreds of people were quarantined, who are suspected of having the coronavirus in the US. Of course, the officials are not confirming it, but in the coming days, we are likely going to get big surprises in the US. But I cannot confirm right now if these are all infected people, but I know that I have seen several reports that the US has detained as much as 800 people, and they are waiting. They are keeping them in quarantine just to see, if they have the coronavirus or not. So we are likely going to see some big surprises coming from the United States this week. Now, Italy, 1 death, 22 cases. A town is in quarantine right now. Iran, 4 deaths. So that's about it for tonight. I have read stories from a very credible source. It's about I'm telling you so you can be prepared if the outbreak reaches your country or the area where you are. It seems that now people get infected with the coronavirus. At first, they do not have any symptoms for up to 2 weeks, or maybe even more, like 3 weeks. And during that time, they are contagious. They can spread the disease to other people, and they have no symptoms whatsoever. And then they start having symptoms like coughing, like the normal flu, basically. Coughing, a fever. It's mild in most cases. But now, that's the thing with coronavirus. And you need to be aware of this. For 15 to 20% of the people who have got infected with the coronavirus, at some point, they have a shortness of breath and they require emergency medical care. They cannot breathe. And I have been told this is exactly how this happens. The patient is fully conscious, and the only thing that he has is he cannot breathe. And they arrive in the hospital and they are telling the doctors, I cannot breathe. At that moment, it's urgent that they need to be put on a oxygen mask, a pure oxygen mask, and that's what they do in the hospitals. And then that will allow the patient to breathe better. If the patient doesn't get the oxygen mask, it is very likely that he will die out of the shortness of breath. And that happens to 15 to 20% of the people who are infected with the coronavirus. So it's very important, if you get infected, that you are ready to get medical care right away if you start getting a shortness of breath. But even with the oxygen masks, there are a certain number of people who die. And from my calculation, it's about 5% of all cases. 5% of all cases are going to die right now, with the best medical care. And they have said that they have done an autopsy of the lungs of people who have died of the coronavirus, and they have noticed that the inside of the lungs, there is a mucus, there is a substance inside the lungs, a mucus, that prevents the oxygen from going into the lungs. So this is why the person feels that he cannot breathe. The oxygen doesn't get into his bloodstream and he ends up dying. So, keep that in mind. It's very important. If you're ever sick with the coronavirus, you have a shortness of breath, you need to go to the emergency room, and you need to tell the doctor to put the oxygen mask on you right away. That this is not a joke. Because I'm telling you, you need to be prepared for that. Because when there will be an outbreak in your area, and the hospital waiting rooms are going to be full, and there will be no doctors to take care of people. If you need to be prepared to get that emergency oxygen, or else you are likely to die. So I'm Rob from iTech Pickers. We will see each other tomorrow. I'm keeping a close eye on whatever is going to happen regarding the coronavirus. This is a global pandemic in the making. It's the perfect storm, and it seems to be like the perfect virus, the super virus, something that we probably have never seen in the history of mankind. So, and keep in mind, this is not a earthquake. This is not a tsunami. The numbers that you see right now, 15 people dead outside of China for the whole planet. It may sound like it's nothing to you, but this is going to grow at an exponential rate. So this is why we are likely going to see deaths and and numbers of people infected in the millions in the coming weeks, in the coming months. So I'm keeping an eye on that for you, and I will see you tomorrow. In the meantime, please subscribe to my channel. Like this video if you liked it. If you don't like it, you are free to dislike it. This is we are in a free country here. We are not in China. And if you have an opinion about the future of this, if you have your own theory, you are free to write it down in the comment section. This is an ongoing discussion. So I'll see you tomorrow.